This is the Emergency Medical Minute, brought to you by HCA Health One.
Hey guys, Dr. Lynch here. Today I want to talk about some febrile seizures. Let's start off with a case today. You have an 18-month-old male, comes to ED with his parents, brought in by EMS for evaluation of a seizure. Mother's at bedside. She provides most of the history. States that the patient had like a runny nose. It started yesterday, maybe a little congestion. Woke up this morning, felt warm. She didn't take his temperature. And then about 20 minutes later, she noticed he was kind of out of it and then started shaking all over. So she panicked. She calls 911. And she thinks the shaking lasted about 2 to 4 minutes or so. And then by the time EMS arrives, he stopped shaking, but was pretty sleepy. His blood glucose was 95. His temp was 102, which is 38.9 Celsius. And then he gets brought in the ER, transported on pulse ox, and that was all normal en route. And then basically by the time he gets to ED, he's back to his baseline now and playing. So the vitals on arrival to the ED, again, he's temperature 38.4, heart rate about 130, blood pressure 90/50, and breathing about 24 times a minute. His exam, he's pretty well appearing. He's interactive. He's got some nasal congestion. He ranges his head and neck without any real distress. His lungs are clear. No respiratory distress, no rashes, no obvious vocal neurological deficit. And then the parents are extremely distraught and ask you to test for everything. So really our first branch point comes up now. So is the patient A, still seizing, B, kind of postictal, or C, back to their baseline? And then the second kind of branch point here is to determine, is this a simple or a complex febrile seizure? A simple febrile seizure is one that lasts for less than 15 minutes, and there's only one in a 24-hour period. And then during the seizure, there's no focal features. So what I mean by that is, so you can have tonic-clonic movement, that's okay. But if you have a seizure with just your left hand shaking, that's a focal feature. And that makes it a complex febrile seizure as opposed to a simple one. Other thing that make a complex febrile seizure are if it lasts for greater than 15 minutes, or if you need medications in order to stop it. If you have any sort of Todd's paralysis afterwards, any for like focal deficits during it, like I said, and then if you have more than one in a 24-hour period. So assuming our patient comes back to baseline and this is a simple seizure, for the purpose of this discussion, there's two kind of big things here. One is really, acknowledging the family's fears, because this is a super stressful event for families. And then number two is the workup. So basically the workup for a simple febrile seizure really is the same for any patient who came in that age with a fever. So really, really good physical exam is super, super important to evaluate for any signs of like meningitis or sort of intracranial or any like head or neck infections. And then really thinking about, is there any sort of bacterial source of infection, such as a pneumonia or UTI, that we need to address? And then it really should be noted that similar to most well-appearing, vaccinated children with a short duration of fever, most children with a febrile seizure do not require any screening labs, CSF, or CTs. So I want to talk about some like basic myths and facts of febrile seizures. So start with the facts. So these occur in patients who are about 6 months to 5 years old. By definition, you do have to have a fever. So that's a temp of greater than 38. And then there's a couple kind of theories of why these happen, but one of them is that they're caused by the actual rate of temperature increase as opposed to the absolute temperature number. It is the most common pediatric convulsive disorder, and about 2 to 5% of children in the U.S. will experience a febrile seizure at some point. And they're usually seen with kind of common childhood infections like acute otitis media, URIs, GI infections, UTIs, and then patients with a family history of febrile seizures and developmental delay are also more likely to themselves develop febrile seizures. The patients who present with a febrile seizure have about a 30 to 40% chance of having another febrile seizure. But, and this is a really, really important but, only about 2 to 7% of the children with a febrile seizure will go on to develop true epilepsy. And then there really is strong evidence that, Prophylactic antipyretics such as Tylenol, they do not prevent the occurrence of febrile seizures during an illness. So disposition, most of these patients who develop a febrile seizure can be discharged home. You do not need antiepileptic drugs to be started on them. They do not need EEGs. They do not need MRIs. But what they do need, and I can't stress this enough, is they need a completely normal exam. So these are the patients, if it's the middle of the night, you got to turn the lights on, you got to wake them up, you got to have them start playing with something. They need to be absolutely back to baseline. If they're not, there could be some underlying infection that you are missing, and these are the patients you do not want to send home if they are not completely normal. So just a quick little summary here. Febrile seizures, super, super common, happen in kids 6 months to 5 years of age. Got to have a temp of greater than 38. The key is differentiating, is this a simple versus a complex? Remember that simples are less than 15 minutes. They have no focal features during the actual seizure, and that it only happens once in a 24-hour period. This is super common, affecting about 2 to 5% of children in the U.S. And then of those who get it, 30 to 40% will have another febrile seizure before they reach the age of 5 years old, but only about 2 to 7% will go on to develop epilepsy. That's all, guys. Thanks. Have a good day.
This has been the Emergency Medical Minute. Thank you for listening, and thank you to HCA Health One for their financial contributions. Support from them and from listeners like you helps us achieve our goal of spreading free education to the masses. If you'd like to help, please donate. Follow the link in our show notes. Thanks for listening.